Well, the federal government says the continuous migration of doctors from the country is not peculiar to Nigeria, but an emerging global challenge. Now, a mechanism to engage Nigerian doctors and nurses in the diaspora and connect them with universities and hospitals in the country is in the works. Minister of Health Osagie Ehanire said this while presenting the scorecard of the Buhari administration's legacy in the health sector from 2015 to date. He points out that the migration of doctors has affected many countries of the world in Europe, Africa, and other continents.
The very high workforce mobility of health workers is global. Doctors are moving and nurses are moving everywhere. I've had occasion to speak with other ministers. Even Ghana, they are losing doctors going to... So there's a high mobility in the health sector workforce, globally, internationally. So we should not knock ourselves only as if we are just the only victims on earth. No. What we are doing about it, first of all, is to do everything we can to improve the conditions of service. We have improved the hazard allowance. We're looking at how to improve the remunerations. But we are also looking at how to now introduce a better form of performance-based remuneration. So that doctors don't just receive simple grade-level salary, but according to the work that they can. So we try to measure performance and let people be happy that they have been properly rewarded for what they have done. And what we are also doing is to do what we call conversion of brain drain to brain gain. And we're doing that with a new mechanism that is being set up now to engage Nigerian doctors and nurses and pharmacists in diaspora and connect them. The program is just beginning. Connect them with here universities and hospitals, because modern technology makes it possible for somebody to be delivering a lecture in New York and we are sitting here looking at that and hearing it. So we can have those who are able to transfer knowledge to do so.
Minister of Health Osagie Ehanire there, and he joins us now in the studio for more on this conversation. Thank you so much, Mr. Minister, for being on the news tonight. We do appreciate your time.
Thank you for inviting me.
Great. So let's begin from this brain drain. I mean, the president has expressed concerns, and he charged you to turn that into brain gain, talking about skills repatriation, and you highlighted it in that speech over there. But can you expatiate? Tell us how that's going and how that is stopping brain drain or stemming it.
Okay, very good. We have established at the Ministry of Health now a unit for diaspora engagement. And we are already in touch with Nigerian medical associations, including nursing associations and pharmacist associations in the United States, in Canada, in Great Britain, in Germany, who are all interested in connecting with the system back home to offer services virtually. They used to do what you call medical missions free of charge, but this doesn't even have to be free. They can be remunerated, and they can now be able to connect us here in Nigeria with cutting-edge technology in medicine and also latest knowledge, because all these are developed first and foremost in those countries.
Well, it's interesting to note, but scary too when you look at the figures. I mean, in the UK alone, 10,296 medical professionals from Nigeria contributing to this brain drain that you talk about, and I'm wondering exactly how you reverse that. It's interesting, the mechanisms that you have in place, but I'm interested in this performance-based remuneration to check brain drain. Exactly how is it going to work? I mean, since performance of these health workers really depends on, you know, what you equip them with to do their job. So if you don't equip them well, which is why many of them go on strike every now and again, if you don't seem to equip them well, how do you then, you know, rate them in a way that will be reflected in their performance, which largely depends on government?
Okay, well, before I speak about that, I would like to say that what I mentioned yesterday is also that we are graduating up to 3,000 doctors every year. We are losing about 1,000, so net There is no brain drain net. What we are losing is the caliber of doctors who are already experienced, who are ripe, who are mature, who have gathered a lot of experience.
Isn't that a challenge in itself?
Yeah.
Yes, it is. That's exactly the challenge. And that is, and also the mechanism for employing doctors, because there are quite a few unemployed doctors around, and also the mechanism for being able to quickly employ doctors one for one. When one doctor resigns, to quickly replace him. Because if you have to go through a long process to replace someone who left, then you have a net deficit inside particular institutions. And that's the problem we have right now. So we have developed a way of what we call the one for one. One doctor goes away, you are now free to replace him. One nurse goes away, replace her or him.
Right.
So that part is taken care of.
Yes, and I'm asking the question of the performance-based remuneration.
So
yes.
Going back to the performance-based, we in our fields know how to measure performance. We know that very well, and those who are practicing privately, they know that too, in the sense that how many patients have you seen, and what level of experience does this doctor have, and what is the level of satisfaction of your patients. So those are things that the doctors themselves can measure and come up with a mechanism for remunerating. For example, for surgeons, what kind of surgery do you perform? How many surgeries? Those are things that are in many ways manageable, and the patient will also have a choice in places to even select which doctor they want to see. So that now gives you the drive to, it also affect your attitude in that if patients have a choice and say, well, I'd like to see Dr. A or Dr. B or Dr. C, which they already do in the private sector because you choose which private hospital you want to go to. So if you go to a public hospital and there are a range of doctors, you can also determine that you would like to see if that doctor is on duty. If it's an emergency, of course, it's a different ball game. So those freedoms that you have are already in use in many advanced countries, and that is used for also improving the system in creating a little bit of performance evaluation and remuneration according to what the outcomes are.
And that's interesting, but I want to reiterate, a part of Ngozi's question about condition of service. I mean, what you give, you cannot give what you don't have. Again, resident doctors, National Association of Resident Doctors,
threatening to go on strike.
Are threatening to go on strike, and some of their issues include, medical residency training fund, outstanding payment of the arrears of hazard allowance, non-payment of the skipping arrears for 2014, 2015, 20. These are recurring issues.
Yeah.
So if you do not fix these issues, can you still morally say, based on your performance,
this is what you
this is what you get?
Well, performance is always a part of any enterprise. There's no question about it. But it is true that the conditions of service need to be improved. They need to be constantly improved. We need to continue to look at how we are equipping our hospitals. But I will say that at this time, the equipment is not that miserable. There are places that are really very well equipped, and there are hospitals that are performing quite well, actually. The way you manage your hospital also plays a role, the management style. There are certain hospitals that we have in the sector who are doing quite well in that they are able to dedicate themselves to making sure they procure equipment that they need, even by themselves.
You're talking about public hospitals?
I'm talking about public hospitals, okay, that they even procure equipment that they need. They plan their own building, they build wards. So depending again on the way you manage your hospitals, you can do a lot. The federal government sooner or later will have to, there's a health reform committee that the president has set up that is at work now. That's going to come out with results very soon. But part of what they are doing is how do we fund our hospitals? The number of hospitals that the federal government manages has risen from 5, 6, 7 years ago to 50-something, 50, 56, and increasing. So if you are managing that many hospitals continuing to increase, and you have to provide equipment for each one, pay everybody, something eventually has to change. That equal attention to all will become difficult with time because they're getting so many. So a way of being able to give the hospitals the opportunity and the chance to solve their own problems by themselves, recognize their own problems, solve their own problems, decide which specialties they want to really focus more on, apart from general specialties, and also source the equipment they're looking for by various methods. For example, by leasing equipment and paying over time. So they can now take those decisions over time by themselves. And the resident doctors, and there are also possibilities of better managing those residencies. We're looking at those ones too.
Very quickly, I mean, speaking of resident doctors, I would like to get your response. What's the government's response to this the threatened strike? I mean, they've threatened to go on strike. We don't know how soon that's going to be. I'd like to get, your reaction to that. And still on the issue of brain drain, in the Philippines, for example, there is a government policy where nurses are exported to different parts of the world. Deliberate, underscore that. That way, they send back huge sums of dollars to help the Philippine economy. Is there any plan to look at that kind of template so that this brain drain, can actually be converted to brain gain? Brain gain.
Well, manpower export. Yes, we have discussed that. We have actually discussed it. If you increase the number of schools of nursing, for example, we have a large number of medical schools, and many of the foreign countries looking for nurses are looking for a certain caliber with a certain level of experience already. Not all of them are looking for fresh graduates coming out of school. So you must have gathered some experience. So we have discussed it. We have discussed increasing the output. At the moment, we are producing a good number of doctors. We need more medical schools and nursing schools. We also need more schools of health technology, because the deficit is also very strong at the primary healthcare level. That's why you are supposed to give help to rural and indigent people, or also rural dwellers. We do not have enough schools of health technology. We also do not have enough nurses. We don't have enough doctors. Hardly will you find a primary healthcare center that has a doctor. So we need personnel at that level too.
Right. Okay, the resident doctor strike, threatened strike.
Yes, the strike, well, I have always discussed with my younger colleagues that the strike is not a good thing in the health sector, because you are putting people's lives at risk. We'll continue to discuss, and as I say, jaw is better than war. So we'll continue to discuss until we find solutions. And some of the issues they raise are from way back, some as far back as 2014.
Are you meeting any of the demands at all?
Well, yes, many of them have been met in regard to hazard allowance, but the solution to many of them are not entirely with the health sector. They are outside the health sector. They are with the salaries, for example. We don't determine when or how many. Honorable
Minister, we kind of have you here and not talk about what the achievements have been, because you spoke about them yesterday, but if you could summarize, very briefly in 20 seconds, what would you say has been the biggest achievement of the Buhari administration when it comes to the health sector? Well,
very certainly is the ongoing effort to expand healthcare to cover more Nigerians. I don't think that probably half of Nigerian citizens who are not getting any form of healthcare at all, who are on their own, who have to resort to herbs or something. So the expansion of healthcare for universal health coverage has been a major achievement. The introduction of the Basic Healthcare Provision Fund, and now the introduction of the National Emergency Medical Service and Ambulance System. Those are new things which will be game changers if they are realized.
Fantastic. Minister of Health, Osagie Ehanire, thank you very much for joining us on Newsnight. Wish we had more time to explore a whole lot of other issues in your sector. Thank you very much.
Thank you for inviting me.
Thanks for obliging us.